Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Hundreds of VA doctors working at the VA doctors, are putting out a warning that cutbacks and policy changes threaten veterans' care. Okay, so I don't know. What are your thoughts? I mean, on the surface, of course, right? It sounds that way. So yes, I'm a fan of pulling in more information and not just jumping straight to it. But I could imagine that cutbacks and policy changes could threaten veterans' care. Now, before we jump into this, I will kind of give you my kind of second thought is, well, if they're shifting, and they, the VA, are shifting from internal VA care for veterans to a broader care from anywhere perspective, which really is incorporating and embracing community care. Is that part of this puzzle? I don't know. So this just came out actually on September 25th, 2025, and I am sharing it with you here today. Please hit the thumbs up for me, subscribe, share with a friend, all that good stuff. I really appreciate it. Every thumbs up, every minute watched really does help the channel. And I will tell you this, Clay over at the CivDiv and myself, Jason, here at the Veterans Info Tap, our joint channel, Veterans Daily, have combined forces to create evidence-based VA claims to assist you with your claims in the event that you are unable to find a capable and competent accredited veteran rep. Now, we offer a free email consultation, and we guarantee that you will get an increase on your VA rating. So there's that. All right, let's jump into it. Hundreds of current and former VA doctors, nurses, and other caregivers have issued a warning to the Department of Veterans Affairs about the negative impacts of the agency's recent staffing cuts and other policy changes. In a mass letter sent Wednesday to VA Secretary Doug Collins, the agency inspector general and congressional leaders obtained by CNN, the group warns that workforce reductions and moves to outsource care to private sector doctors and healthcare facilities will harm veterans. There's a quotation here. We write to raise urgent concerns about proposed policies which, in addition to ones already enacted, will undermine VA's healthcare system, overwhelm VA's budget, and negatively affect the lives of all veterans. We have witnessed these ongoing harms and can provide evidence and testimony on their impacts, the group wrote. More than 160 doctors, psychologists, nurses, researchers, and others signed the letter initially. Since the group sent the letter, the number of signees has grown to 350, according to one of the letter's organizers. More than 25 doctors signed the letter by name, and many others signed it anonymously. Okay, so I just had to pull this up real quick. To put it in perspective, the Veterans Health Administration has over 26,300 physicians on its staff, representing a substantial portion of the nation's healthcare workforce and critical resources for advancing veteran care. So again, number of physicians the VHA, Veterans Health Administration, employs is over 26,300. So, there's 350. So there's 26,000 that did not sign the letter. Now, I'm not saying that it's not true, but I'm saying that there's a lot of people not willing to put their name on the line for whatever that's worth. So let's move on. More than 25 doctors signed the letter by name. Again, there's 26,300 physicians, and many others signed it anonymously. All right. In recent months, CNN has spoken with more than a dozen doctors and nurses. Okay, so more than 12. And again, there's 26,300 in the VA healthcare system about similar concerns. Many of them asked to remain anonymous out of fear of retaliation from the VA. The letter does not mention President Donald Trump by name, but it references recent staff cuts and other policy policies undertaken at the VA since Trump took office in his second term. Collins and other VA officials have repeatedly stressed that changes will not hinder veterans' care and are in fact designed to reduce bureaucracy and improve efficiency at the agency. In response to the letter, VA Press Secretary Peter Kay, because it's hard for me to say his last name, said in an email to CNN, VA is serving veterans much better under the Trump administration than it was under the Biden administration, and the numbers prove it. Peter Kay said the backlog of veterans waiting for VA benefits is down considerably under the second Trump administration and cited a recent announcement that the VA is realigning $800 million to improve infrastructure at VA healthcare facilities, which I would venture to say that there are the majority of you, not all, because some of you have some pretty nice facilities, but my guess would be that the majority see that there are some improvements that need to be made at some of these aging facilities. All right, so $800 million to improve infrastructure at VA healthcare facilities. Of the shift towards more private sector care for veterans, Peter Kay said, VA has made it easier and faster for VA enrolled veterans to access care from non-VA providers at the department's expense. And I'm going to give a big thumbs up on that. Well, whatever. The normal size thumbs up on that, because this is what's happened. A couple things. One, the community care aspect was kind of, I guess, muffled down a little bit in the prior administration. And I understand from an employer kind of perspective, you want to keep your clients coming to you. You want to keep your customers coming to you so you could keep your doors open. So I get that the VA didn't really want to send people out into the public. At that time, they would rather a veteran wait an extra 10 days or however many days it was to get them through the VA doors. So I understand it. I don't agree with it, but I understand it. Next, we get into the current administration, and they've made it public that they are embracing community care. Okay, what does that really mean? Okay, it means that it's not muffled. It's not disapproved as quickly. It's approved more readily. And what did they do to make the approval process easier for veterans who are seeking community care? This is huge. They eliminated the second approval that was required. There used to be two approvals. There used to be you talk to your doctor about going and getting community care. Then they go, okay, and they push it up to another doctor who doesn't know anything about you, who has to now make that decision on whether or not you get to go. So they've eliminated that second approval, and they put it in the hands of your, we'll just say your primary care, right? Whatever the authorizing doctor you're talking to, whoever that person is. So that is awesome. That's getting rid of unneeded BS. Why? Because you're talking to a medical professional. They're a medical professional for a reason. You're the patient. You two together should be considering whether or not community care makes sense for whatever the reasons that are listed on why you would be able to get community care. All right. The second thing that the current administration or the VA secretary did to help with community care is there used to be smaller windows of accessibility once approved. So in other words, sure, veteran, you're approved for community care for the next 3 months or maybe 180 days, right? Just kind of depended. So 90 days, 180 days, good to go. Now for I don't even remember, I think it's 30 something conditions, 30 something different sort of ailments, the VA has now authorized a 12-month authorization period for you to go to and fro for your community care. So you don't have to go back and get reauthorized and all that stuff. So super great. Let's move on. Democrat Senator Richard Blumenthal, the ranking member of the Veterans Affairs Committee, said of the doctor's letter, Courageously and powerfully, VA physicians are sounding an alarm. In fact, a 5-alarm fire on devastating damage to VA healthcare as a result of this administration's funding cuts, contract cancellations, and personnel firings. Their warnings, made at great personal risk, need to be heeded. Heeded, not heated. Heeded. Doctors react to recent VA moves. The doctors who signed the letter, entitled the Lincoln Declaration, after President Abraham Lincoln's call for veterans care that served as the basis for the VA's creation, are particularly worried about the rapid pace of the VA's moves toward outsourcing veterans care. That policy is collectively known as community care. And the VA has been devoting an increasing percentage of its budget to that system over the past several administrations, both Democrat and Republican. For those that don't know, the idea of veterans' choice really started with Obama to help kind of get veterans care, right? VA was really behind in certain areas. This thing kind of popped up as a veteran's choice to allow veterans to be able to go get care where they need it. And I think it was created as kind of a Band-Aid to just let the VA kind of catch up and then slowly wrangle everybody back in, maybe. Then when Trump came in, he really solidified it and made it a real solid program. Then when Biden came in, it was still there. It's just internally within the VA, they kind of muffled it down a little bit and made it a little less easy, I think, to get community care. And now that Trump's back in, they've opened it up and then made it a little more accessible. Now, I will throw this out there. There are great VA medical centers, there's great VA clinics, there's great personnel, there's great physicians, doctors, nurses, all of that stuff, all over the nation. But there's also not so great areas, as evidenced by my own experiences and as evidenced by your comments. There are certain circumstances in which you're like, I don't want to go see anybody in that specific facility. My experiences have been horrific every single time I've been there. And I don't like any of the doctors that I've had to see. And I would much rather go across the street to such and such medical facility and work with a doctor that I've been working with or that I've worked with in the past that I really enjoy and I like, and they understand me and my condition. That exists. So what I think needs to happen here is veterans should have a choice. Veterans should have a choice. I personally believe veterans should give the VA a chance, and then if it doesn't work out, then somewhere else. What I don't think should ever happen is I don't think that the VA should ever force a veteran to only receive care in one specific area, right? So community care, for example. I don't think that if I call in for care, make an appointment, and they go, okay, well, we're going to have you see Dr. Blankety Blank at Blankety Blank Medical Center. And I go, well, I don't want to go there. I'd rather come to the VA. And they go, sorry, that's not a choice for you. I think that's wrong, right? So it's kind of all over the place. I'd love to get your thoughts on this so far. This has really turned into a community care discussion, and the fear, because they haven't really said why veterans health is, and I can see what the argument is, but they haven't really said it. So why is a veteran who has PTSD, sleep apnea, GERD, and migraines, why is their health care at risk if they go to a specialist in the community versus going to somebody at the VA? The argument could be that, we deal at the VA with veteran-specific conditions and we understand the veteran as a whole. I mean, that would be the argument, but, we'll see. So the doctor's right. Rapid growth of purchased community care threatens to divert resources from VHA's high-value direct care. VHA refers to the Veterans Health Administration, the medical arm of the VA. The VHA oversees all of the agency's hospitals and clinics and almost every aspect of veterans health care. The doctors wrote that if the trend toward outsourcing to private sector continues, VHA facilities may be forced to close, and veterans may be forced into costlier, often overburdened community health systems, ill-equipped to meet their specialized needs. Okay, so that is their worry. So then the question now is to you. Do you feel as though you are getting, when you go to the VA, do you feel that you are getting an underburdened healthcare system that is well equipped to meet your specialized needs? So, I don't know. I mean, for the conditions that I have, right? Back issues, migraines. I have an eye issue that my eye's like a snow globe now. I was mortars, 81 millimeter mortar. Out it goes, and something flew in my eye, cut it, got a corneal abrasion. My eye got all crazy, infected, and weird, and whatever. So, I have never, ever once went to the VA for an ophthalmology doctor, right, to look at my eye. It's always been the private sector at that level of specialty. So, I don't know. For me, the answer is no. The VA is not well equipped to meet my specialized needs, right? So, I'd love to get your thoughts. Dr. Dean Winslow is, and look, I'm just being devil's advocate here. These are also people want to self-preserve, right? Self-preservation. I don't want my doctor's office to close down. I don't want my VHA facility to shut down and then I don't have a job. We need people through the doors. This is undermining VA healthcare integrity, and it's going to hurt veterans. We need to force them to come through the doors and see me. Maybe there's a little bit of that. I don't know. Dr. Dean Winslow is willing to take any risk of retaliation from the VA for the letter. Winslow, who signed the letter by name, is a retired Air Force colonel who served in 4 deployments to Iraq and 2 to Afghanistan as a flight surgeon. He now works as a professor of medicine at Stanford University and has medical staff privileges at the VA facility in Palo Alto, California, specializing in infectious diseases. The VA has a special expertise in caring for veterans, Winslow told CNN. It's a multidisciplinary, integrated system. It's worth fighting for. The non-VA system doesn't have the expertise, and the for-profit insurance-based private system is incredibly expensive and inefficient, Winslow said. Joy Henry, a psychologist and veteran who owns Desert Wise, an outpatient mental health clinic in Albuquerque, New Mexico, also signed the letter by name. The clinic is in the private sector, but it specializes in treating military members and veterans referred there by the VA. How funny is that, right? No community care. We specialize in veterans. We do things right for veterans. Here at the VA, VHA is the only way. Oh, by the way, Joy Henry, a psychologist and veteran who owns Desert Wise, an outpatient mental health clinic in Albuquerque, New Mexico, who also signed this letter, who we're told it's all VHA doctors, so -1 from that, and who knows how many others. This is weird. Also signed the letter by name. The clinic is in the private sector, but it specializes in treating military members and veterans referred there by the VA. I'm pretty sure that there are veterans in the U.S. who've started other medical practices who could say that they are doing the same thing. Anyway, I think that that's really a weird. They probably, to make their argument, they probably should have just left that out, because that's really, this person should not have signed the letter, because if you go back to the very beginning, and it says hundreds of VA doctors and caregivers warn that cutback policy changes threaten veterans' care, and it goes on and on talking about all this stuff about the VHA's healthcare system and VA's budget and VA and we signed, and what was it? They said more than 160 doctors, psychologists, nurses, researchers, and others signed the letter initially. Since the group sent the letter, the number of signees has grown to 350 according to the letter. Okay, so the whole idea is that this was VHA workers, VA employees, and then, now we get slapped with this, which is really funny to me. All right. Although her clinic benefits from the VA's outsourcing of care, Henry says she's concerned as a veteran who gets her own physical medical care at the VA. Farming us veterans out to the lowest bidder is hardly in keeping with Lincoln's promise, Henry told CNN. Okay, so I'm just reading between the lines here a little bit. They were just saying that it's way more expensive to go to the private sector, and really the lowest bidder is the VA. So, okay, farming us veterans out to the lowest bidder is hardly in keeping with Lincoln's promise, Henry told CNN. Veterans are not a commodity, nor should our health care be. And again, let me ask you this. Here's the reality, right? Everybody's situation's different, whether it's geographical, whether it is physical capabilities, right? Some people are laid up in a bed, need a team to move them, to take them to their doctor's appointment, right? Maybe the VA facility's an hour and a half away, but there's a doctor across the street, right? Maybe it's financial, right? Maybe, and I get it, right? You can get your reimbursement from the VA, blah, blah, blah. Still, you're paying for it at some point to get there. What are your thoughts? Should a veteran have a choice? Should a veteran who wants to get care in the community be able to get care in the community if it meets their needs? Or do we say, no, you don't get to. Sorry. You got to call your kids to come load you up in their car and drive you to your appointment, or you got to coordinate with 15 different people to get some sort of a van ride from DAV, right? Do we force people to only go to the VA, or did you earn the capability to get your care what works best for you? All right. One of the most prominent veterans advocacy groups is also supporting the doctor's protest letter. Kyle Ann, I think it is, Hunter, Chief Executive Officer of Iraq and Afghanistan Veterans of America, said in an email to CNN, and there's a quotation, "The VA is a public health system that centers on veteran care. It is part of the promise made to everyone who serves. We must do everything we can to ensure that promise is kept." According to the Iraq and Afghanistan Veterans of America, less than a third, 31% of its members who had experience with VA community care system felt that private community care providers understood their medical needs, and only 14% said they had confidence that private and VA teams coordinate properly. I'd love to get your thoughts, right? I personally felt good with my community care experience, but I've also had great experiences with the VA. I've been in, I think, 1, 2, 3, 4, maybe 4 different kind of VA regions. if you will. I've had great experiences really everywhere overall. But my community care stuff, again, has been great too. So it's just what works the best for me with my life and what's going on. And I get it. Look, here's the, if you hung on till the end, here's the real, I think, problem for people at the VA is, oh my gosh, if we start to open up the doors and allow people outside of the VA to provide services, now all of a sudden there's a choice. And if there's a choice and people don't come to us, we're going to have to shut down. And the initial part is scary for the employee. The kind of the back end here is us as the veteran. If we don't use it, it will go away, right? If we don't use it, we will lose it. So if you have, whatever the number is, 20,000 veterans utilizing a clinic, and then all of a sudden they, I don't know, 80% of them decide I'm going to go use community care instead, that clinic's probably going to go away. Then you're going to complain that the VA shut down the clinic, right? We cannot have our cake and eat it too. So, in my opinion, as each individual, we need to have a more hybrid approach. Utilize the VA when you can. And then in the other circumstances, when it makes sense, then utilize community care. All right, with that, thanks for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.